Problems in your foot and ankle complex can have compensatory effects in the rest of your body. When you have rigid feet, weak ankles, and tight calves, that can create pain in your knees, your hips, and even your back. So gaining mobility and strength in this complex is going to help reduce the fascial restrictions and make your body more energy efficient with your movements. The ankle has the movements of plantar flexion and dorsiflexion. Plantar flexion, dorsiflexion. Eversion, when the lateral side of the foot comes up, and inversion, when the inner side or the medial side comes up. We're going to start with a knee bend. Your legs, feet are going to be hip width apart. And you're going to start with a slight knee bend, okay? So when you go into the knee bend, that's dorsiflexion. When you come out, that's plantar flexion. So I'm going to have you go ahead and start doing that. You can use your arms to gain some momentum. And when this feels really easy, then you can start with more arm movement, and we're going to bring our arms up higher, and then we're going to go to the balls of our feet. So on our tiptoes. So up and down. So we're going up into plantar flexion, down into dorsiflexion. Plantar flexion, dorsiflexion. Do this about 15 times. Or just stay with the slight knee bend. Wherever you are. We're going to do the single leg balance. So lift one leg up. Doesn't have to be high. If you need to touch your toe down, that's fine. You're going to try and hold this for 30 to 60 seconds. You'll want to be doing that for both feet. If you need to hold on to something, feel free to hold on to something, but you're working towards not having to hold on to anything. To progress that, start by holding on to something, and you're going to go single leg and then up on your toe. That's going to take a little bit, but try and work up to your 30 to 60 seconds. You're going to strengthen the foot, the ankle, and the calf. Touch your toes down. Everybody can really benefit from this. Going to a step. We're going to do pedaling, foot pedaling. So start with one foot completely on the step, and your other foot is going to just be the forefoot on the step. You can have slight bends in your knee, engage your core, try and keep that tall spine, a string attached to a balloon. You're going to drop your heel down for a nice stretch in your calf. Hold for 2 seconds. Come up to your toe. You're contracting that calf muscle for 2 seconds. Drop down, back up. Down 2 seconds, up 2 seconds. Do that on the other leg also. Heel down 2 seconds, up on your tiptoes, squeeze that calf for 2 seconds. Do that about 15 times. When you can progress from that, you can go forefoot with both feet, dropping both heels. There you go. I have the wall right here too. Drop both heels down, then up on your toes. Trying to do that for 2 seconds each way. This is strengthening our foot, our ankle, and our calf, and you're gaining your balance. Next, we're going to do a balance beam walk. I'm just using a rolled up yoga mat. You can use a half foam roller, or if you have like a 2x6. And we're going to do toe to heel walks. If you need something to hold on to, that's fine. But what we're working towards is not having to hold on to anything. Turn around and do the same. If you can practice this every day and even multiple times a day, you're going to be able to move with more ease, and it's going to have a really positive impact on your health and well-being. Keep moving.